Is there a new COVID wave beginning? Is there a new variant threat? Is a fresh national COVID wave in India a real possibility? Let's examine this issue objectively with Dr. Randeep Guleria, former director of AIIMS, chairman of the Institute of Internal Medicine, Respiratory and Sleep Medicine, and director of the Medical Education at Medanta. Dr. Guleria, I feel like we're back. We've done 2 years of shows like this every Saturday night, and unfortunately here we are back. Asking you this question, do we now need to worry? You have the biggest ongoing COVID-19 wave in this, now these COVID cases coming out of China, now speculations about a wave in India, high-level meetings at the national level, state level, mock drills, some advisories based on speculation, one school shut down for a while. I'm sure you can understand this has created a bit of panic, apprehension among citizens of India. So please, can you clarify for us your thoughts on this? Should one be worried? What does one need to do?
So my thoughts on this are that one needs to be vigilant, but I don't think there's a need to panic. As we see every year during the change of weather, and this time the weather has been a little bit peculiar in terms of the fact that it's rained a lot, even the last 2-3 days. There is going to be a surge of what we call respiratory viral infections. We saw a surge of influenza H3N2. And now we're also seeing a surge in COVID cases. As long as we don't see a surge in the number of admissions or a huge increase in the number of deaths, I don't think there is a cause of concern, but we need to really be vigilant because there's always a concern that the variant may become more virulent. Currently, for the last, I would say, more than a year since Omicron came in, all its sublineages or the variants that have come have actually caused predominantly a mild infection. And we've seen a number of variants of Omicron coming in and now the XBB also. But by and large, they've all caused a mild infection, fever, cough, sore throat. The infection hasn't gone down into the lungs as we saw during the Delta wave, causing this acute fall in saturation, oxygen need. However, the high risk group, the elderly and those with comorbidities need to be extra careful because they are the ones in whom there can be a hospitalization and death.
Okay, so you're saying unless we see more admissions into hospitals, one doesn't need to be so concerned. But when you said high-risk groups, you only mentioned the old and those with comorbidities. What about children?
So children also come under the high risk traditionally. What we've seen in COVID is that by and large, except for very young children, most children usually tend to have a mild infection. COVID actually somehow causes less severe infection in children because of the ACE receptors being less in children. However, I think the concern that I have is that if a child has infection and the child goes to school, then he can transmit the infection to other children and they can carry it back to their families and give it to their elders. And that's how we may have increase in number of cases and more sick people.
We've had many debates on whether schools should be closed because those kids are then going to the mall and still passing it on to other kids. So, but the other concern right now, Dr. Guleria, is the emergence of this XBB 1.16 subvariant, right? So this, what about like when we hear of all of these subvariants that keep coming up, the vaccines that we've all gotten, the currently used vaccines, do they protect us against these circulating subvariants and sublineages and new ones that can come up?
So the vaccine do give us some protection, but obviously the degree of protection comes down. It's not because the vaccine is actually against the original Wuhan variant. And from the Wuhan variant, we've had the Alpha, the Beta, the Delta, the Omicron. We've had so many variants, and therefore the efficacy of the vaccine will be less, although it won't be zero as compared to the new variants. And that is why there is a need for us to actually now look at a new generation vaccine, which actually covers the new variants. As we do for influenza every year, we have a new flu shot every year, new influenza vaccine every year, which covers for the new strains. We will possibly need to look at that. The only positive thing is, I think, because it's a mild infection, we have a good degree of natural immunity because of infection that people have got. And although I think we need more data on that in terms of, surveillance to see how it is the antibodies, like we used to do in the past, a general surveillance to see how in the general population, what is the antibody titer, are we protected? But it does seem that most of us have got the Omicron infection at some point in time and are to some extent protected.
So lastly, Doctor, what advice, what would you tell our viewers watching in terms of social distancing, in terms of traveling, in terms of sending their kids to school, just basically living life? Masking.
I think we need to be vigilant, and if you have anyone at home, especially a child who has got fever, cold, cough, the child should stay at home, not go to school or to shopping malls, and spend at least 4-5 days at home so that he becomes all right and doesn't spread the infection. Secondly, COVID appropriate behavior probably we should bring back for the next few weeks till the weather really settles and summer sets in properly. So in terms of hand washing, wearing your mask, trying to avoid crowded places, I think those things we need to bring back. And especially for the elderly and the high risk group, I would really advise that if you go out, wear your mask, carry your hand sanitizer, and avoid crowded places.
All right, Dr. Guleria, thank you so much for your time, your service, for just trying to help assuage any fears that are out there. We have a rising COVID count, but not yet a cause for worry. We know more about protecting ourselves today, and the virus is less virulent. But as Dr. Guleria says, we need to continue to be vigilant, and we have to perhaps go back to some of those basic techniques to protect ourselves, like wearing masks and avoiding crowded places. Thank you so much, Dr. Guleria, and thank you all for joining us on Left, Right and Centre.